we're live.
All right, good morning. It is 6 de Mayo. And it is Senate Health and Welfare Committee. Can celebrate every day. Good morning.
Good morning.
So we have 583 in front of us, and have we done anything at this point? I know there was testimony. There were some folks who were very concerned about I think the concerns were more about confidentiality issues than trying to change the bill radically, although I have seen one recommendation for changing it. So why don't we just look at the bill another time, go through it briefly and we've heard from the healthcare advocate and others about the bill, and then we'll think about what we've heard and how it affects what we're looking at.
Okay. Good morning, Jen Harvey from the Office of Legislative Counsel. This is H 583. I'll put it on the screen. Check my share. So.
And Sam, while we're getting ready, I remember when you testified, did you have any specific recommendations about changes to the bill? Or it was really support of the bill?
Yeah, we definitely support the bill. There are a couple of changes we had with the board, a couple of reporting suggestions around that section. So when we get to that.
Okay, we'll do that.
Yep.
This is H 583, an act relating to clinical decision making. And a new chapter in Title 18 on clinical decision making starts out with definitions, which I assume for the most part you don't want to look at, although you may want to look at I think the hedge fund and private equity were the ones that people maybe spoke the most about. We can look at those if you want.
Let's look at those.
Okay, so it defines hedge fund as a pool of funds managed by investors for the purpose of earning a return on those funds, regardless of the strategies used for managing the funds. It includes a pool of funds managed or controlled by private limited partnerships. It does not include individuals or entities that contribute or promise to contribute funds to a hedge fund, but don't participate in the management of it or its assets, or in any change of control of the hedge fund or its assets.
So let's clarify that. So it means that it's just the hedge fund and the managers of the fund itself, but not folks who are contributing in to make that a fund.
Right.
Exactly.
Putting money into a fund does not make you part of that.
Got 3 questions.
Was some question about if a local group got together and wanted to promote something in a healthcare facility, but they be considered in this bill.
Well, it's managed by investors for the purpose of earning a return on the funds, as opposed to investing in a right. And
Yeah.
So I don't. It doesn't strike me immediately, but I'm certainly not as well versed in financial management as others.
Senator.
Just before that, did I see that you said something about partnerships?
Oh, it just specifies that it includes a pool of funds managed or controlled by private limited partnerships.
I'm just wondering, several doctors go in to, they're a partnership, they own a medical office. Is that?
So I don't think that's a pool of funds that's managed. I mean, it's looking at a pool of funds that's managed for the purpose of earning a return on the funds. Want to add, Mike?
Yeah. It's the hedge funds. There. Okay.
So it doesn't include people who are just, or entities who are just contributing to the fund, but don't participate in managing it or its assets or change of control or of the fund or its assets. Or entities that solely provide or manage debt financing secured in whole or in part by the assets of a healthcare facility. And that includes banks, credit unions, commercial real estate lenders, bond underwriters, and trustees. Not a hedge fund. And then other one we had looked at was or talked about was private equity group. It's an investor or group of investors who primarily engage in raising or returning capital and who invest, develop, dispose of, or purchase any equity interest in assets, either as a parent company or through another entity the investor or investors completely or partially own or control. Does not include, again, like the hedge fund, it does not include individuals or entities that contribute or promise to contribute funds to the private equity group, but otherwise don't participate in the management of the group or its assets or in the exchange of control of the group or its assets.
So it's not limited to healthcare facilities, right?
I mean, this definition itself is not, but the use of it in the bill
And the bill
is.
is,
Right.
I don't think I want to be roping in every hedge fund.
No,
Sure. To the extent that they are involved in ownership of healthcare facilities, yes.
we
Yeah.
can send it down to you and have you include everybody.
I have it.
Right.
Those seem to be the main definitions of concern, so I'm happy to go through any of the other ones, but I'm not sure if we need to at this point. And then section 9772 is limitations on control over clinical decision-making by private equity group or hedge fund. And this is the section that talks about making sure clinical decision-making and treatment decisions are exclusively in the hands of healthcare providers and safeguarding against non-licensed persons like private equity groups and hedge funds exerting influence or control over healthcare delivery. Has the specific prohibited activities for private equity group or hedge fund that is involved in any manner with healthcare facility doing business in this state, including as an investor in the facility or an investor or owner of the assets of a facility. Prohibits them from doing any of the following with respect to the facility: interfering with the judgment of healthcare providers and making healthcare decisions. It gives a specific list. Again, I don't know how much detail you want to go through, or if we're just reminding what's in the bill. Okay. So including a specific list, also prohibits them from exercising control or being delegated the power to do any of list of activities around clinical staff, patient records, setting the prices, rates, or other charges for healthcare provider services, making decisions about coding and billing.
So it's really staying out of the delivery of healthcare.
Right.
Oh,
And then it also prohibits a private equity group or hedge fund or an entity controlled directly in whole or in part by one of them from entering into an agreement or arrangement with a healthcare facility doing business in the state if it would enable them to interfere with the ability of healthcare providers to make decisions. So prohibits both the activities and entering into agreements that would allow them to make those decisions. And then it specifies that the organizational form of the healthcare facility, so how the healthcare facility itself is organized, does not affect the applicability of this section. But it also says nothing in the section should be construed to prohibit an unlicensed individual or entity from doing non-clinical activities, management, administrative, or business services, assisting or consulting with the facility with respect to things that it's doing, as long as the licensed provider retains ultimate responsibility for or approval of the decisions. Then it gives a right of action to a healthcare provider who is aggrieved by the actions of a private equity group or hedge fund or entity controlled directly or in whole or in part by one in violation of this section that allows them to bring an action in superior court for appropriate equitable relief, actual damages, reasonable costs, and attorney's fees.
so this is the right of action. Will have
Yes.
it's just run it by the chair,
It's a limited right.
judiciary. Yeah, it's limited. Okay.
It's only for a healthcare provider and it's only for violations of this particular section by private equity group or hedge fund. Then we have 9773, the reporting of ownership and control of certain healthcare entities. So it starts out with some language around dates that I think have been part of some outside conversations. So I don't know if you want to pause there. It starts by having reporting begin on July 1st of 2026.
Yeah, I'm just looking at that date.
That was a little,
Presumptuous.
that was a little advanced for their timing preference. So we'll
Yeah.
hear from other folks.
Yes.
Madam Chair and Committee, Diane Lanford, Green Mountain Care Board. I know that, I think you said the committee had asked, Green Mountain Care Board when they testified to work with the healthcare advocate to come up with some of the points and submit it to the committee on, I think it was last week or May 1st, the letter. But the timing, we don't have a process or the mechanism right now for this, at the moment. So that would need to be developed. So the timing would need a little bit more additional time and an opportunity to work with the stakeholders to come up with what kind of information and come up with them. And then it was a suggestion, but of course it's up to you to come back at HROC with an update and a final report in March. We'd like to be able to help, but we want to make sure that we.
You said in
March of 20 with a final report in March, but
I think that makes a lot of sense. It allows for some work to get done.
right.
Madam Chair, sorry, and I apologize, Diane, because I'm not sure you were part of the loop of this conversation, but Sam and I and Elena and Emily looked at language that we shared with via email with you and Jen Kirby, that the board felt was sufficient. That doesn't almost everything
Almost everything.
that Diane said, other than the come back to HROC. It sets us in motion, gives us some more time, sets
Yeah.
the enacting out.
So I'm fine. Yeah, I don't think you need to come back to April.
Okay.
It really doesn't.
All right. So
But we could move the date out and have the report coming in March. That makes a lot of sense. So there's time for everybody to get together. I know there are a lot of concerns about this, but it's also an important step forward for the state, given what we see in different parts of the world. Yes.
I don't think this is targeting towards Jen or one of the things, maybe some of the advocates helping
What is the question?
questions is, I think last time we discussed this, there was some questions about hospitals or other entities that may be receiving some form of services from an entity that may fall under this. I don't know if that's true or not. And I guess my question is, if there is, how many, and what are the kind of the impacts?
How many of what?
How many entities out there that would fall underneath this legislation are working for our hub? So I don't know that. So what's the impact would be, is my question. And I don't think that's a Jen Cargan question. I think that's a.
You should know. I mean, are we gonna shut down the emergency room?
In some,
Somebody.
I don't know that.
Or.
Are you talking about the clinical decision-making part or the
No.
reporting part?
The reporting is simply, do you have hedge fund dollars?
Right, we have it,
To make it very
So we-
simple,
Right, we can look
how are you being
at that
financed
language.
differently from net patient revenue and philanthropy? Are you being financed or owned by a hedge fund? That's really the question that's here.
So that's the only question that's here.
I think,
Let's look at the language, because I stopped because you were talking dates. But let's look at the language. So by a date certain, which may be a different date certain than what's in the bill.
it's
right now.
definitely a different date.
Each healthcare facility and each management services organization must provide to the Green Mountain Care Board either, if they did have private equity or hedge fund ownership or investment interest as of June 1st, 2026, or perhaps another date certain, certain information. So if they did have private equity group or hedge fund ownership or investment interest, they're going to report some information. We'll see in a minute, or they're just going to say, no, we don't have any. So for a facility or management service organization that does not have private equity group or hedge fund ownership or interest as of that date, then they would attest that they don't have any. So for each one that does have private equity or group or hedge fund ownership or investment interest, they would report to the board the name, business address, and business identification numbers of each person that, with respect to that facility or organization, has an ownership or investment interest, has a controlling interest, For healthcare facilities, they have to report if somebody who has, an investment or ownership interest is a fund management services organization, or if they are a significant equity investor, which was a defined term. So they're going to report on who has some ownership and investment interest in various ways. A current organizational chart showing the business structure of the healthcare facility or management services organization, including where anybody in this list shows up. Affiliates, including entities that control or are under common control as the healthcare facility or management services organization, and subsidiaries. And they're going to provide their most recent fiscal year's profit and loss statement and balance sheet. And then going forward, they would report anytime they get new private equity group or hedge fund ownership or investment interest, or there's a modification to an existing interest.
Okay, so we're only providing information.
Yes.
So what's the information for?
Well, some of that gets reported.
I understand that. But what's the information for?
To understand the investment that's being made and the concern, I think, take the next step.
That's,
The concern is that in the past, including in this state, and currently, and I know about currently in this state, but I know other places, hedge fund investors have bought up facilities, healthcare
close them
facilities,
down, I think.
and then they closed down. So the concern is who's buying up what and for what purpose. So once you know that, then at least you have an understanding of who owns what. And the conditions that are in the bill that preclude that investor from affecting the delivery of care is critically important. So they might invest, but the investment needs to ensure that the organization stays sustainable.
Okay.
That's it. So I don't.
And maybe to clarify a little bit too, the bill
Yeah,
is,
please.
the bill as introduced, would have prohibited certain forms of ownership. So it would have sort of taken a next step of saying certain forms of ownership of healthcare facilities is prohibited. Upstairs, there was a lot of concern from various stakeholders saying, hold on, let's find out who even owns or has these ownership interests in this state before you decide that it needs to be regulated in some particular way. So that's how we came to this piece that is, let's find out who's invested.
You brought up something I hadn't thought about, but what we heard in other results is that hospitals contract other services. So it could be the radiology, it could be the ER services.
Right,
could
this was the
be
outsourcing.
a bunch of outsourced services. And I mean, we don't know whether any of those outsourced services are owned actually by hedge funds. And if they are, and you go back to the earlier part of this bill, that could be a real problem because they do own it, or they potentially could own it. And so they have impact over the actual services that are provided. And this bill would say you can't do that. So I don't know if any of those services fall under here, but that could be an issue.
Her services.
Right.
Right,
Right.
right. And so you may want to hear from others, you know, from people who are involved in the outsourcing. I think the idea here is separating the financial ownership interest from the clinical decision making and having healthcare, healthcare professionals making the clinical
If I
decision.
go back to Senator Cummings' comment, doctors do join together and create a clinic, and they're not going into business to lose money. They're going into business to create a clinic, provide services, but at the same time, actually generate revenue. So,
But I think the difference is that they're not generating revenue, back up to the hedge fund here, for the purpose of earning a return on the fund, to be managed by investors for the purpose of earning a return on the funds.
I don't know, that's you don't start a business to lose money. You start a business.
You want more primary care too, so
Yeah.
you want to develop this.
think it's clear enough, but
I think it's clear.
it's good to have somebody who knew business law, yeah,
Somebody who,
new business law,
oh,
take a look at it just to make sure that we're only doing.
who do we have on?
We're doing no harm.
I mean, I don't know that anybody in Ledge Council is
No.
versed in hedge funds and private equity. But I think, you know, we could see if there are folks at Department of Financial Regulation.
Yeah, Gail, you wanted to make a comment?
Yes, so Gail Zass on behalf of Planned Parenthood of Northern New England and the advanced practice nurses. So we are mostly concerned about the reporting part of the piece. We don't have any issue with the section that prohibits the clinical decision making, but we are really mostly concerned because there are so many healthcare entities in the state. All the healthcare entities are going to have to file something. They're going to have to file an attestation or they're going to have to file a report. And a lot of these healthcare entities are small entities. They don't have a lot of staff. They don't have legal support to help guide them in this process. So one of the concerns that we have related to this is what guidance is going to be provided by Green Mountain Care Board or others. Is
So
there going to
that's
be?
your question. And I'm looking in the corner over here and the comment that Diane made earlier about bringing all the stakeholders together and establishing a process and guidance. So can you talk about that?
Correct. That would be our position that they're thinking. Unless anything has changed in the last hour that I don't know about, but that we would like to make sure that this is not a process that we're usually in the business of and or having a relationship with, but I think the Green Mountain Care Board and others realize that this is with the healthcare advocate, very important piece to uncover what's going on in Vermont. And so it would really take the cooperation with stakeholders, people that to figure out a way that how do we process this? It's not overly burning on any entity.
Right. So the independent practice that is just making it.
Just even figuring out.
Attestation.
Yeah.
That's checking a box.
It says,
Yeah,
yes,
I got it.
yep.
Understood.
But also the
Okay, no, okay, just one more comment. That's it. Because we really are moving. We want to.
sort of a two-parter is how do they figure out whether they fall under the attestation part or the reporting part? And then the other question we have related to this is why is all of this reporting necessary? To what end? What is this information going to be used?
That's a separate question. I think our concern is hedge fund ownership of medical facilities and organizations that may result in some closure in our state, precipitous problems. So that's a concern. It's just no way around it. The issue that you're talking about is making it difficult for a smaller entity. And I have a lot of faith in the board and the stakeholders getting together to avoid that. So, we can talk about this for hours, but I think ultimately the work that gets done by whether it's March 27 or July 27, that will be critical and key. And then also knowing that nothing is static in this world. We'll see something coming back as usual. The people who are here will look at what happened in the future.
Jim, having just come through a public panic situation before I tried to do something good, which was telecom facilities going on the property tax. And then having a whole lot of broadcasters and facilities get a letter saying, you have to give us your inventory because we don't know what's out there. And you've got a 3-person shop running your radio station. It caused panic. And when you say facilities, I see a hospital
So I see too.
and we don't have for-profit hospitals. I don't necessarily see private doctors' offices. And that doesn't seem to be where the hedge fund system is.
Or they could buy up. They could buy up 250 independent practices in the state and then close them all down. So there's, you know, I could be a very devious hedge fund thinker.
It'd be worth money.
I have to get upstairs.
I know, okay, can we just quickly, just have you have a minute to just finish off a little bit, finish the bill? Look, we're gonna finish the bill right now. We're just gonna go through with Jen one more time. And the suggestion for changing the date is one. And then we may look at some other suggestions from, I think, Healthcare Advocate and Green Care Board.
But that's what we're.
Yeah.
We're talking about if two doctors form a partnership.
Right.
That's different. Not a hedge fund.
Right. They're going to get the letter telling them if it's causing confusion here, it's going to cause confusion in their office. I think we need to be very clear
Understood.
about
Yeah,
what they
you're
need
right.
to do.
So it is healthcare facilities and management services organizations that have to provide the information. So if we have to go back and look at our definition of a healthcare facility and here is the definition used for certificate of need purposes. So it is quite broad, and does include, I believe, individual providers' offices, although they are not required to get a certificate of need. A management services organization is an organization or entity that contracts with a healthcare provider or provider organization to perform management or administrative services relating to supporting or facilitating the provision of healthcare services. So we looked at what has to be reported. And when there's an update, there are some exemptions from reporting for nursing homes, healthcare staffing companies, federally qualified health centers, and entities whose healthcare services in Vermont are only through telehealth. Information is generally public and not confidential, proprietary, or trade secret, except for individual healthcare providers' taxpayer IDs that are also their social security number, and any non-business contact information is exempt from public inspection and copying under the Public Records Act and kept confidential. And all profit and loss statements and balance sheets submitted are exempt from public inspection and copying under the Public Records Act and kept confidential, but they will be shared with the Green Mountain Care Board, with the Office of Healthcare Advocate by the Green Mountain Care Board, which is then limited for them. There are penalties for knowing failure to report and for making material misrepresentations. It allows the Attorney General's office to maintain an action in Superior Court to collect and seek appropriate injunctive relief. Then we have section 9774 is the report by February, under this bill, by February 1st, 2027, and every 2 years thereafter, the Green Mountain Care Board would post on its website a report on the information provided during the previous 2-year period, including numbers of facilities and management services organizations by business structure, names, addresses, and business structures of entities that have an ownership or controlling interest in each, change in ownership, change in tax ID number, and as applicable, information about other affiliates under common control, subsidiaries, and management services organizations, including business type and tax ID number. Again, public information except an individual healthcare provider's taxpayer ID that is also their social security number. And it allows the board to share information reported under this whole chapter with the Attorney General, Secretary of State, other state agencies, other state officials to reduce or avoid duplication in reporting or facilitate. Thank you. It's good you did go upstairs. Oversight and or enforcement under Vermont law for both, and tax ID numbers and other confidential information may be shared with other state officials who agree to maintain the confidentiality. allows the board to merge similar reporting requirements where appropriate, and it would take effect on July 1st.
So here's what I'm thinking. I think that, we've heard from everyone, and I know that some of the folks who drafted, helped write and wrote sections of the bill and really gave strong input to the bill. Now I'm hearing that they are not happy with the bill. That's difficult when it comes from one place and go to another, and there's a difference of minds have changed. So what I do hear are maybe some legitimate concerns about the smaller entities. Maybe there's a way of putting some guardrails in there that the board will begin by looking at larger organizations. And then we can have some gradual inclusion of different levels of groups. So that's a thought. I think the date is problematic, hugely problematic. Much more time needed there for people to get together and get the work done. So committee, we're going to come back to this bill. It has been worked over quite a bit in the House. It started very broad and much bigger, and now it's much smaller, and people have compromised a great deal. We want to make sure there's confidentiality included, and if there are suggestions about that, we've listened to that. But so I think what we'll do, Jen, is we'll leave it for now, and then we'll come back to it when you're here in committee.
I don't think I'm here again this week.
You're not back again, but we'll find a time for you to be back.
You have time tomorrow morning. You want to fit me?
You do? Good. All right. That'll be good. So we can start at 8:30 tomorrow, and Katie will just push you back a little bit.
Thumbs up.
Okay, do that.
All right.
Thank you, Chair.
All right. Thank you. Thanks for your time. Sorry to keep you from upstairs. But this is a much of a play.
Good job.
Same thing.
One step on the one that lady put in that the board.
Yes. I don't know where to go from there. I don't, whatever. It's not a big deal.
I agree.
They're making a mold of Mount.
Yeah.
I gave it for everybody.
We're still live.
You want to take.
Yeah, I wanted to.
Brenda, I have moved on. We've been on.
No, we have this one.
Yeah. We've all been sick.
Guys,
Sorry.
It's time. You
Okay.
Lily.
Say
that. That's what I kept saying. That woman behind you is gonna be squashed.
And I can.
Oh,
You're so hot.
Sorry.
Quick, I mean, I'm okay.
Lily.
Yeah, I know.
Lily, so
They don't have a chance.
Yeah.
Oh,
Don't have that issues.
Yeah.
No.
Oxygen.
yes.
I think you guys need to be moved.
I need.
That's my
Oh,
sign when
I
Robbie.
This morning. Oh, you want to talk?
Call.
Yeah.
Okay.
Additional side quests besides you.
Very spring.
And then it rains.
Need her.
Yes.
What?
Yeah. And so you guys can.
Nolan and I mean, yeah.
1, 2, 3, 4.
And it's.
You don't count as numbers in the book. Nolan,
Yeah.
shall we begin where we left off a little bit and go through some of the,
Okay.
and I know that I asked folks to give me information about what's included in each of the line items in the, but I don't know that we're gonna get that. This bill's going out.
I'm still struggling with this bill because we haven't heard from anyone who's actually doing the work on the ground. And it's, to me, this is a nice academic paper.
Who do you want to hear from?
Well, I asked 2 weeks ago.
Oh, I know.
American
Here's the issue is this, that there are how many, 14 different
That's caps.
Caps.
No, this is not a cap. They are actually right now cutting the ribbon on their newest shelter down
Right.
here on Barry Street. I can't be there because I'm here. But they're the people that are gonna have to do
Yes,
this level, this level, this level of shelter. And if they can't do it on the ground, we're wasting a whole lot of time shuffling money around up here. That's my concern. I am having a real difficult time visualizing what we're changing.
understood. We can. I have talked with some of the folks in my local area about this, and so maybe we'll talk about having some of our shelter providers come in. But we can't have all the shelter providers come in, nor can we have comprehensive testimony. We received this bill just a couple of weeks ago, and we've worked on it. We don't have the luxury of time that sits upstairs. So, it's unfortunate. So we're also depending on what work has already happened in the House. But so certainly, Senator, we'll try and get someone here tomorrow for the next day. And I'm looking at Amy and Lily, I don't know who else. but-
And somebody in here.
There you go. Yeah.
You want to put them in the chair now rather than me, or?
Well, they don't run shelters.
Oh,
What Senator Cummings is talking about is someone boots on the ground who's actually running shelters.
And have
What
they,
does this mean to them?
in fact, do they have enough shelter beds to be able
Capacity.
to divide them up with low barrier, high barrier?
Yeah.
Or
We're never gonna get the answer to the question you're asking. All we can do is guesstimate. And we can figure out based on what the agency tells us, what HOP tells us, what our shelter providers overall tell us. That's what we can do. And I don't think regardless of how much testimony we take this.
but it's shelter providers who have to.
Yeah, we'll hear from a couple.
okay.
Okay. So let's go through, Nolan, real briefly, what we had started looking at yesterday. And, you gave us a spreadsheet. Want to make sure I have the right one.
I threw out my own one feet, that's gonna change.
No.
Yeah,
That's the one.
So here.
5/1/26.
Oh, I got that. That's from-
Yeah.
Understood.
What would you like to know?
Okay. So here's the process that we'll use this morning. We'll just spend a little bit of time on it, and then we'll move on to the language that's in the bill. What I need to know from folks sitting in the room, and it's the question that Senator Cummings is asking. We've got a line item here with top grant operations. And I think Lily's a point person for that one. What does that mean? How's that money being utilized? Where is it going? How many providers are included in that? And how do we know that it's sufficient to meet the need, or is it too much to meet the need? So those are the questions we're asking. And then we can't shift that money around.
You can,
Yeah,
and the House did.
it's in
Okay, I
base.
just want to make sure.
So-
1.8 million.
And just to, if you say this enough, the administration's line, to steal their line would be, the GovRec is their line.
That's about.
So,
But
but
how is that number derived?
sure.
Right, that's really what we're looking at, and that goes for shelter development and so on.
So just to remind you, you can shift like things around, like you can move base with a base, one time with the one time comes along with, right? So you can go up and down. So you could take money out of pop base and put it into shelter base. So right, just an example, It's just moving from base to one time, or you can't move the federal funds, right? Because you can, but can't, right? There's limitations. So ultimately, we want to make sure that in order to comply with the Senate passed budget, that the far right column is zeros across the bottom. So you can move base within base, one time within one time, et cetera. That's my recommendation.
So
So I think
this doesn't matter.
Senator Morley was first, and Senator Johnson was second.
Up in the House committee, you know, the administration has 40 million in base. And they reduced it in the House. And I'm kind of find that interesting because then you go down with the shelter development, they have this one time. And then they put some into base and then something on it. There's some reason.
You could shift things
I
around.
don't know why they did that.
You'd have that stuff.
Well, I'm less concerned about why they did that, Senator, than what we need to do here.
Well, my concern is you want to try to get some of the stuff into your base, right? Not wasting your base going forward in opposed. Whereas one time it may not be there again next year.
Exactly.
So it's a pretty big decision.
It is a huge decision.
And I wasn't in the room when they had all this conversation, so I can't speak to the rationale. Why?
I'll talk to the chair. And,
There must have been some reason though.
Yeah.
What it is, I don't know.
well, maybe we'll bring the chair in here.
That was basically my question. I'm trying to understand why they made the changes
That they did. Okay.
So,
That one out.
I mean, you can kind of glean a little bit, like you can see like they added 1.4 for shelter in the base where
Right.
the governor didn't, or then they put more into emergency housing and less into staffing because they felt that they didn't need as many staff, you know, to do the work. Or because I think some of their theory was to contract out with private entities rather than having state employees doing. So those are the kind of thought process.
So like the emergency coal shelters, I thought was really important. It's in base, but the House put it in one time. Which, I mean, if you had your druthers, you'd rather have it in base than you would one time, I would think.
Again, I think they were thinking
No,
about it
yeah,
in a structural way, like, we do this, then we need less of this, and if we do that, we need more of that, like, and so, you know, it wasn't just, they were thinking about it, but I can't say they were thinking about it as holistic, the whole way, like, how we move this, what, how does it affect the other ones, and not like, willy-nilly. There was some.
Yeah.
But yeah, you should definitely hear from the chair as to what the thinking was for that.
We will do that. So maybe let's just go down the list and, the questions that we're asking, and I'm looking, I'm gonna just look, I know in the room are folks who were included in the discussion upstairs, whether it's the administration or others. And let's just do a very brief rundown here, understanding your responses and what you've learned. And then we have questions for the chair and we'll have her comment if she's available. I'm looking at, and I'm looking at Lily because you're a top person, just briefly.
Do you want to hop in the chair? I couldn't do it. I couldn't do it.
Yeah, so nice. I'm, good morning, Lily Sojourner, Director of the Office of Economic Opportunity within the Department for Children and Families, and we do administer the Housing Opportunity Grant Program, silent G, so we refer to it as HOP. In terms of the governor's recommended budget, which is really, I feel like what we can speak on and what we included, the scope of HOP is very broad, and that is because many of these agencies do more than just one thing in the community. And so it's administratively easier for them to have one grant that oversees like an umbrella versus having to have multiple grants for these different things. But it is quite a long laundry list, and feel free to stop me at any time. So the majority is emergency shelter services to operate emergency shelters in the state. We do have a small amount of funding for transitional housing. Then it funds a number of support services. So this includes coordinated entry, assessment and housing navigation, homelessness prevention, as well as rapid rehousing, Another large category is financial assistance. So this is direct financial assistance to households experiencing or at risk of homelessness. We support the homeless management information system. We also include training and technical assistance. And then last year, and this is included too, in this bill, we have kind of carved out administration for the domestic violence, sexual assault services through one kind of administrator to allow us to provide more tailored training and technical assistance and support. So that's the scope. I'm happy to also follow up with an email that calls out for the year exactly which agencies get which, money for which projects, and that's organized by community. It's 40 to 50 agencies around the state, depending on how you consider projects. For instance, Champlain Valley Office of Economic Opportunity has quite a few separate shelters. So that includes like Samaritan House and Florida's House in St. Albans. And that was the bulk of what we had put in that governor's rec under the HOP operations. We did also include the addition of new specialized shelters. So the money that we had identified for additional substance recovery oriented shelters and shelters for those considered medically vulnerable, as well as some additional financial assistance to support natural connection. So, for instance, someone's able to reunify with a sibling or relative to resolve their homelessness to facilitate that connection. So that was the scope that was in our governor's rec for that top line item.
Do you have that in writing? Get some of that, right?
Yes, we do have a version we can follow up and share. Yeah.
They also have a question about what excludes a shelter from HOP. Is there anything that would exclude a shelter from HOP, or what are the criteria for including a shelter in HOP?
Currently, there are a few shelters around the state that do not seek state funding. It's not necessarily that they're excluded. I think some organizations have private funding. They don't want to work with the state. We come with requirements and reporting. And so, there are some that just would rather not engage with us, because if you are funded, you do have to comply with our standards and guidance. And it again is focused on those who meet the definitions of homelessness, or for other services at risk of homelessness.
Okay, thank you. This is helpful. All right. And why don't we just keep going through unless someone has a burning reason to speak? And if you do, raise your hand, but I want short comments, so it'll help us.
So you have shelter development, which I think is pretty self-explanatory.
Shelter development.
Then you have emergency housing, hotels, motels. I think this committee has been well versed on that.
So the House actually added money in to the hotel motel program. We'll have to hear from the chair on that. And then the shelter development piece, there's less money for shelter development.
And maybe I wasn't there, so I can read into that myself, but I won't say that one.
So is there anyone else? I don't want to put you on the spot, but I won't let you do that. But is there anyone who wants to comment on the shelter development funding piece here?
Do you want me to add an explanation or?
Sure.
So when we think about shelter development, again, and governor's recommended, we're really specifically talking about the work prior to operating. So that could be acquisition or really significant renovation costs to make a facility, either to create a facility or to make a facility available for this. So it really is those one-time significant startup costs per project.
And it could be an organization that's already in existence that's helping to renovate or put a new shelter up.
Yeah, absolutely. It could be that there's, right, it could be something totally new, or it could be an existing shelter that says we want to open an additional site.
So it looks like the house thought that we didn't need as much shelter for a structure.
Or maybe they weren't confident that it would stand up in time,
Yeah, that could be the reason.
which is why they put more into
Yeah.
emergency shelters, thinking that the shelters were gonna be up in time, so they might need more hotels in that transition.
You knew that incident.
No, that's how I interpret it. It wasn't, it's me reading between the lines. Except, Chair Wood might come in like, no, that's not it at all.
No,
But when I read that, that's what my brain tells me.
go ahead, Chad.
Yeah, Chad Simmons, Housing and Homelessness Alliance of Vermont. So I think just broadly speaking, the need for shelter development, for HOP funding, for case management is greater than the governor's recommend. So I think that's helpful context in that. I don't think that's a surprise. We're hearing from providers, both providers that are currently providing shelter, emergency shelter and shelter, that there is more capacity needed for shelters. So we agree that there needs to be additional dollars for shelter development. But under this construct, we're just kind of pulling from other needs. So I think that poses a challenge to the committee and to those of us representing providers in the community that we need to do all of the things. And ideally, we would be decreasing the use of hotel motels, but until we have those shelters, that shelter capacity provided, permanent supportive housing, as Senator Cummings has said, we're going to need to have all of the tools that go on.
And to that point, the House was trying to work within the GovRec AT.
Yeah.
Brenda.
Brenda Siegel, Executive Director at Homelessness Vermont. And on the case management side, there is a large requirement for case management as part of this construct. And so there had to be a balance of, was my understanding, of shelter build, hotel motel, and case management and services. And the hotel motel piece is actually fundamentally less expensive than new builds of shelter. And I think part of the idea was that the real need is permanent housing. And so why are we trying to meet the need in permanent shelter when what we should be moving towards is getting people into permanent housing? And so the case management is a requirement, and there is, just from a provider standpoint, our organization and organizations around the state are drowning. So that funding needs to be there.
Okay, thanks. And then I think Nolan's comment actually is helpful because we don't know how quickly any of this can be put in place. Okay.
Next, the big change you'll see is in the staffing, eligibility staffing. And I think I know the answer, but I'm not going to say it because I don't want to speak and find
Well,
out.
is it related to workforce availability?
I don't think that was it. I think it
not
was
it.
more about I think the committees, maybe Katie or someone in the room can correct me. The committee in the time was thinking about trying to put more of the resources out in the community.
Yeah,
And so that was more of the thinking, rather than hiring more state employees, put that money out into the community for community organizations to be doing some of that work. I think that was the rationale.
so we'll
I see some
find
head
out.
shaking.
So they did put $500,000 into municipal grants.
Yeah, so I think that was some of the thinking about taking it away from, rather than hiring more state employees.
Yeah,
So, okay.
and then I don't know where the other 500 or so thousand went.
I think it's some of the other expenses.
Yeah,
And some of it was like,
case management.
was like trying to get the numbers to, again, they were, to Chad's point, they were trying to work within $82 million contract. That was sort of the world that they had to play with. So they
Yeah.
were trying to redistribute and reprioritize within that sort of closed box, recognizing that they would like to do more. Case management, I think, Brenda, I think, spoke to that articulately.
A little bit about that.
You have the permanent and family supportive housing, it went down 82,000. Rental assistance went up 850,000. They added municipal grants, that was not in the GovRec at all.
Well, it actually makes a lot of sense, because I know how, much money some of our local communities are putting into this. Not just for administration, but that's actual services.
And in the weather shelters, there was a shift from base to one time. So they were shifting, they're trying to find more base elsewhere and within their contract. And then other expenses, they used federal funds for that. We can't speak to it, not thinking behind that.
How would we define other expenses? I can think of some, but
I would defer, sorry, to,
I'm deferring to Lily.
I would hop over to her thoughts. and-
Oh, you're.
Running out of jokes.
Instead of saying I'm interrupting, we're just so in sync, right?
Yeah, we're hopping back and forth.
Thank you. Thank you so much. We gotta get like these benefits.
Who's gonna pay for it?
In
Less shelters, more t-shirts.
in this is where, thank you so much for the question, because this is where the other means very different things in both the governor's recommended and then in the House budget. So in the governor's recommended, it was a specific call out for hotel motel rooms for folks impacted by like natural disasters. And that was a specific call out in our gov rec. In the House budget, it is completely different, and it is a portion of federal funds, the Emergency Solutions Grant that funds the homeless management information system, not all, but a portion. So that's just the difference. I'm not sure.
I'm lost. I don't know the.
I know, yeah.
I
So
need homeless management.
yeah, so we have it in our governor's recommended, it's under HOP, and it's federal dollars that support the homeless management information system, which is a IT solution that we use for data collection and for required reporting to HUD. And then in the House budget, that was separated between, so they kept part of that federal funding still in HOP, but then called out some in a second and in the other line item, and I'm not quite sure why, but that's our understanding of what those
We'll
pieces are.
talk with the chair of the committee and see what the rationale and what it was exactly.
Because it's interesting, because there's all that.
Right, because,
Money versus base.
and again, this, just the scope of others different between the two. So again, good, helpful discussion, and we can send this.
Okay.
Okay. All right, is there anything else here? So we've asked all the questions and we are still not really solid on any one of these, and we don't know exactly what the need is out there. And I think to Senator Cummings' point, we would have to, I think we'd have to interview just about every organization that's providing services. Which is why, hearing from the Healthcare Alliance and the homeless group is important to us, because they do work with people on the ground. But we'll get a couple folks in and we'll have, see if Rep. Wood is available or whomever she suggests in her committee. And then we I am reaching out to have a couple of folks in, from the organizations that are actually providing shelter services, so we can get some of them. I'll do that. All right, good. Nolan, this is helpful. Again, and Lily, one last question,
Yeah.
I guess. You know, one of the things that I'm very concerned about is a community resource center. As you know, I'll keep bringing it up, but the community resource center that's in Burlington, to the OBO there. And making sure that it's included in the funding, because they do significant amount of work, and they also are the hub for a lot of the work that goes on both in Chittenden County and Franklin County. We're trying to sort out how we can make sure that they're included in base funding and going forward. I know one suggestion has been made, and we'll see what we can do with that. I think it's like $500,000. there's some money in the budget now, but if we can put it in here and shift the money around a little bit, that'll free up some money that's available in the budget for other things. So again, to have them included would be great. Anyway, so,
There's community grants, I know here, have hired like a homeless coordinator in the city of Barron
yeah,
that is out on the street on a daily basis, talking to people and getting them into where they need to be and lined up.
and that's part of the municipal, I would think,
Right.
some of the municipal funding that's available. And I'm looking, I see your face, so.
Yeah. Yeah, so just to, this bill and budget is primarily based on the DCF budget and impacts around addressing housing and homelessness. So, Department of Mental Health and, Division of Substance Use Disorder Programming is where outreach efforts, such as the senator just described, are held at the Agency of Human Services primarily. And so, you know, they're significant amount of that work is funded right now through the opioid settlement funds at the health department, and then DMH had some federal funds as well as some general funds. And so just in terms of looking at those activities in the budget, they exist in the agency's budget in those two departments. And that's how the CRC has been funded in recent years is through one-time funding through the Department of Mental Health.
Okay,
Yeah. So if you're-
yeah, I know DMH has funds, okay. Amy, do you want to comment?
Amy Schulberger, for Vermont Community Action Partnership. I just want to note that was not included in the governor's recommendments here for FY 27,
Which was not,
the Community Resource Center. So it
right,
has been funded in the past through DMH with one-time funds. It is not in the governor's recommend. The current big bill has it through DMH. That one-time funding is right.
right, it's 200 and something. 62.
The Senate had 234, 500, and House had 469.
Okay. All right, so I mean, we could shift it over and make it a permanent part of the program. That would be my goal. But yeah, that's. All right, Katie. Hi. So we have kind of a new draft. It's the draft. Tell us what we have.
So you have draft 1.1, you made a few changes, that are highlighted in yellow. Of course, if we struck language, that's not captured with the highlighting. But if you would like, I could go through the changes.
Let's go through the yellow and then we're gonna go back, in the time that we have, we'll try and go back to the bill itself a little bit. To see what's what.
Okay. Here's draft 1.1.
I went through it last night. I think it was last. Like a brochure.
Okay. So page 10 is where we have our first change. You decided to move the permanent supportive housing services out of.
Can you make it a teeny weeny bit bigger?
Yes. Do that. Okay. Better?
Yeah.
Okay.
Thank you.
You're welcome. You decided to move permanent supportive housing out of the levels. And so the levels have changed now. Hotels and motels are level 4 instead of level 5. And permanent supportive housing dropped down as part of the continuum, but not one of the levels. So now it's on line 9.
Line 9, permanent support.
And then there'll be a section specific to that will say. In subsection C, upon assessing a household's needs, the office or community partner shall offer to place the household in the appropriate level of care to address the household's specific needs and capacity, staffing, and geographic accessibility are available.
The word offer is important, I suppose.
Okay, so 2204 is level 1. Subdivision 2, I had inconsistent language, that I only used hotel places and everywhere else we say hotel and motel. So that's why that change was made. 2205 is shelter services. In subsection A, second sentence, the department through the office shall enter into agreements for a period of not less than 2 years at a time with community partners for a provision of highly structured shelter services.
So here we're talking about organizations that are providing services.
Yeah. So this is a sentence that was confusing. I've rewritten it in 2 places, so take a look. Is it less confusing?
It's community partners.
That's better.
Find
Okay.
any.
No, I don't believe so. I'll double check the definition section, but I don't, so. The change,
Let's get into the potential for a 2-year budget. I would love. I've always advocated for a 2-year big bill, but this could be the beginning.
You can't find one legislative session in the.
No, but you can have a BAA in the middle of the 2-year budget.
That's true.
Yes, you can.
That's true.
They do it with the capital budget.
this is.
Oh, I'm sorry.
I don't even know what bill that is.
You're doing testimony center. Well, try to think about your questions while you're gone.
Jeez, I'm sorry.
Okay, go ahead, Kate.
Okay, subdivision 2. This is just a change from the editors. Instead of repeating eligible households ability, their ability, which is easier to read and that appears somewhere else. This in subsection B1, this same sentence is being changed. We just looked at it. The department through the office shall enter into agreements for a period of not less than 2 years at a time with community partners for the provision of low barrier shelter services is being added to be consistent with the language up here on line 17. 2206, level 3, specialized shelter services, that was omitted as it came over from the House. And then in subdivision 1B, the relevant agency of human services department shall enter into agreements for a period of not less than 2 years at a time with community partners. Again, that same change, hopefully for clarity. Subdivision 2, again, the same change of using their ability instead of eligible households ability. That brings us to 2207, level 4. That is being updated because prior to that, level 4 had been the permanent supportive housing. So we're renumbering some sections, we're renumbering the levels. Subdivision 6. Thank you. Again, these changes are because of the renumbering that's happened. And eligible households needs, if they cannot be met by levels 1 through 3 instead of 1 through 4 of the program instead of the continuum, as described in sections 2204 through 2206, because we have one last section now. So those are technical changes.
What number is permanent supportive housing? Level 3.
It's taken out of the level.
It's down out and it's all
Yeah.
itself.
Mhm.
Okay.
So now we have this new section 2208, which is permanent supportive housing, but it's not a level. Also, you'll see that program is highlighted a couple times. That was a change recommended by the editors. I had continuum, which is how the program is referred to, but the defined term is program, so that is the correct way to refer to it. So you'll see that that is updated. So permanent supportive housing services. The office or its community partner shall provide permanent supportive housing services to an eligible household participating in the program. Permanent supportive housing services provided pursuant to this section shall, and then we have language that we took out of when it was in the level. We shall combine long-term community-based rental assistance with voluntary, flexible supportive housing, etc. Instead of a household, an eligible household receiving permanent supportive housing shall participate in case management. That brings us to 2209, other emergency housing services. An eligible municipality may submit a grant application to the office containing an estimated cost of the municipality's proposal and other identified funding sources. The use of grant funding awarded pursuant to this subsection is at the discretion of the municipality and shall include the provision of basic life-sustaining shelter, etc. Good with that? Okay. Another editing change. Emergency housing provided through the program is not intended to be in lieu of access to any AHS time limited or permanent housing. Actually, don't love it, but
Let's just look at that
provided through the program. is not
Intended to be
in lieu
intended to be in lieu.
and not intended to be in lieu. You know, let's not spend committee time on this. I will think about it.
The editor can evaluate this. We need
They're rarely wrong. I would say that they're very good at what they do. Okay.
How
21.
about substitute for?
What do you want?
It's never mind.
Not be intended. I'll figure it out.
I know. Well,
Like another editorial change, program rules and case management requirements shall be reasonably modified, including with the use of plain language. Okay, and now we're in
Kind
kind
of
of
an editor's correction too.
that is, yeah.
Ooh, okay,
I had them look at the whole draft.
yeah.
I assume by the time we're ready to vote it out, we'll be more in crunch time and they had a little bit more time to do it yesterday. 2212, time limits for program participation. Level 4, those 4s are highlighted because remember we had a other level for the permanent supportive housing that was removed. So we're making some updates. On line 18, continuous had been continual. So now it reads that the eligible households may receive continuous services, and we've updated the cross-reference. Case management services, no changes, needs assessment. Oh, changes to this, even though we don't highlighting, notice appeals right to fair hearing. This section is shorter than the last time you've seen it. 3 subsections.
What page is that on? Where are we?
I'm on page 26.
Oh. So
Um,
past needs assessment,
mhm.
past appeals right, so there is an appeals right that remains.
Yep, so there is still an appeal to the Human Services Board. There's still information about notice of the right to appeal, but the specifications about the process have been removed and the language about 20 similar appeals being
Right.
considered
Policy.
policy have been removed. So that language is gone. And I have this period highlighted to remember to say that. Let's see, rulemaking, you have added to the rulemaking and subdivision 10, I'm on page 27.
Mhm.
Expectations for the office's oversight and quality monitoring, including performance measurements applicable to all community partners and grantees.
I just will say, I think we should look at the rulemaking piece a little bit. It doesn't have to be right this minute, but we'll come back to it.
Okay,
But because it strikes me, having been a rules LCAR person for so many years, it strikes me as quite broad. And I think we need to give direction, otherwise we're gonna see a LCAR problems
okay.
and other things. Okay.
2217 is reporting, again, replacing continuum with program. And then, subdivision 4D. So the lead-in is the utilization of hotels and motels, including the number of eligible households denied a hotel or motel room due to authorized rooms being fully occupied. Switching continuum with program. What else? This was a typo, transition to the Vermont homelessness response continuum. Omitted on. Okay, this is the bridge program. So I took the language that you reviewed I did do a bit of reorganizing, and I have heard that is people are nervous to see the reorganizing. So if this is problematic, I am happy to receive feedback on it. But I felt like it needed to lead with the program being established, and sort of describing what the program was before we went into the details of the program, which is why I tried to flip some of the paragraphs. But this is language you looked at. New language in B1, the agency shall collaborate with the Vermont State Housing Authority to develop a framework for establishing a unified housing voucher program that consolidates the voucher assistance currently provided through the agency's departments. In developing this framework, the agency and the Vermont State Housing Authority shall analyze the fiscal implications of consolidating existing voucher programs into a unified program, including projected costs, potential efficiencies, and impacts on funding sources, assess the projected impact on the total number of individuals served and on distinct populations, including individuals exiting homelessness, individuals facing eviction, individuals with mental health challenges, individuals with disabilities, and any other population served by the department administered voucher programs. Identify administrative, operational, and statutory changes required to implement a unified program and propose options and recommendations for the structure, governance, and implementation of the unified program. Agency and housing authority shall report their findings to the policy committees by January 15, 27. And in C, I have the language that the housing authority and relevant departments of AHS shall work jointly to incorporate existing rental assistance that is funded by AHS and its departments and designated for Vermonters exiting homelessness into the program established in the section, and establish eligibility criteria and any prioritization that may be necessary for the use of funds appropriated for this purpose and the appropriate length of assistance under this section. Subsection D, the program shall not provide the full amount of a household's rental payment and shall not be a permanent voucher. The duration of the assistance through the program shall be temporary and determined based on the specific needs of the eligible household as established by the agency and housing authority pursuant to state. And then the new E, the program shall be accessible to eligible households served by each of the agency's departments with priority given to those exiting homelessness. And that might be it for changes.
Yeah.
Okay.
Okay. So, okay, and then it's got all the money. So the last section is 14, it's the appropriations section. All right, and committee, those are some of the things that we talked about going through the bill itself. And I think it would be great, I know in particular on the Human Resources Board sections, you get a response from the agency on that. I know that's a huge concern. There is timing in there. Maybe Katie, we could go back, show us the page on that one and go back through that one. And there's some timing pieces for appeals.
So you wanted to go back to the grievance section?
Yeah, that whole section. And then I'd like to go to the rules section.
Okay. Okay. So what you currently have is page 25. Oh. The office or a community partner shall provide written notice to any applicant or household whose participation in the program is denied, reduced, suspended, or terminated. And you have what's included in that notice. The specific factual and legal analysis.
Hang on a second. Let's go a little bit slow. Okay.
Sure.
Go ahead.
Okay, so this list is what has to be in the notice to applicants and participants who are denied, reduced, suspended, or terminated from the program. So first, the specific factual and legal basis for the office or community partner's decision. The effective date of the action, which in the case of termination, reduction, or suspension of services shall not be earlier than 30 days after the date of written notice and the household's preferred method of communication.
So receive the notice 30 days before they removed.
And 3, a statement of the right to request a fair hearing pursuant to this section. 4, clear instructions and plain language on the process and deadlines for filing an appeal. That's section B, an applicant for or a recipient of assistance pursuant to this chapter may file a request for a fair hearing with the Human Services Board when an application for assistance under the program is denied in whole or part, the household's benefits are terminated, reduced, or suspended. 3, the household believes that benefits have not been provided in accordance with applicable rules or policies.
So the question is, and I'll look at the agency for this one, is how does this differ from current process, if at all?
Yeah, Deanna Hartog, Vermont Legal Aid. That part in reality doesn't really differ from what we have right now. The 30-day receiving notice at least 30 days before the termination, suspension, or reduction is new. But in terms of the actual Human Services Board process and the reasons for which someone could appeal are substantially
The same.
the same.
So it's a 30-day period. And so if this were the current process, what would be, is there a 30-day window before services are ended?
Brenda Siegel, there's not a current process before services are ended. In other types of appeals, you can have retroactive benefits, but you can't here, and I think that might be part of the reason that was trying to be addressed.
Okay, and then we're going to have to hear from the agency about this. We don't want to put something in. The difficulty for me is having different processes for the same board. And I know that can get really confusing quickly. So this is one program, and every single program had a different process. There would be difficulty. Yeah, go ahead.
Yeah, I just want to note
And
that
for the record.
for the record,
Yeah.
Hartog, Vermont Legal Aid. There are already different processes for different benefits of the board because there are federal regulations for Medicaid. And so I obviously don't want to speak on behalf of the board, but I think they are pretty adept at using different rules for different processes.
Okay, and I know I think we have a bill up on our wall. It's S-36. Anyway, there was a bill somewhere up there on board process. So as I had said before, I'm really not interested in opening up a whole new section on the Human Services Board, but if we can put something in place that facilitates the program and helps folks, I think it's not a bad idea. But so we'll wait and hear from the agency.
Yeah, Brendan Atwood, Policy Director with the Agency of Human Services. So we'll have legal take a look at this and just make sure that they don't have any concerns. I think at first glance, it looks like something we can be amenable to. I think the notification pieces, we've got some concerns around the scope and just the workload that it will require to give those notices to everybody throughout the continuum. It may be more appropriate to do this just for folks in the hotel motel program rather than, for example, for shelters and all of those pieces as well. And then looking a little bit further down, I think we just want to get a better legal analysis on the impact of continuing services in those situations where they file an appeal within, I think it's 14 days here.
Okay, that would be good. I know there's going to be a balance here. Sure, it'll be important to see it. Okay, we got some people over here. We have legal aid.
Deanna Hartog, Legal Aid. I think also a concern that we have is that 3 VSA 3091, which is the statute authorizing Human Services Board appeals, only contemplates actions or adverse decisions taken by the department or other offices of AHS. And one concern that we have is that there's no appeal process for community providers who are going to be providing a lot of the housing services within this. And so that is something that we noted that would be really, really helpful, so that there is a way that community provider decisions can be appealed, that due process is still upheld without requiring, affirmative litigation, which is extremely costly and burdensome. So
Sounds like a whole new section.
we emailed some language that would not.
Well, I'm not,
So
well, you can email it to us. I'm
We
not
did.
sure we have the time to fully evaluate. That sounds like another, as I said before, sounds like a whole nother bill. It's a big discussion. It's not a simple discussion. It is for you, because you've been thinking about it, but there's a lot of people in the room for whom it's not. So we'll have to think about that one. Brenda, you want to comment?
Yes, Brenda Siegel and Homelessness Vermont. I will definitely relay and correct me if I'm wrong, but I'm not sure that the statute addresses continued benefits, which right now hearing officer can order. So I would want to just make sure that that is continued. If they feel that you are likely to succeed on the merits of the hearing, then they will order continued benefits. We have plenty of clients who have our,
That's another one.
but that's not new, that's current.
Yeah,
So we would want to make sure it's here because it's
well,
not.
we either change it or we don't change it. But we'll think about that. We don't want people to lose their benefits.
Right.
No question about it.
Yeah.
Right, because most of these folks absolutely need the services and the shelter that they're getting.
And it would take something away.
Understood.
Okay.
Senator Fulick and then Senator Cummings.
My understanding is we're at the last 3 days of our committee, is that correct? It feels like we're getting so much feedback on all of our bills, not just this one. I'm wondering how we're gonna make this work.
Well, we're gonna make it work, and I will say that as the bill came over to us, there was a very delicate and in some places delicate balance. There was a balance, and we're identifying some of the places where there was huge disagreement. And so this is one of them. So the Human Services Board, and I know the agency is very concerned about this. And for me, I'm also concerned about doing a whole big change, legislative change for the board. So I think we can do it. I'm optimistic. So we'll just keep moving along and we'll get there, right? With you, Senator. We also can meet next week. We can meet in the morning early for an hour or two, every day before 10 o'clock. But I'm trying to avoid that as much as possible. I know we'll make some changes to the bill. It may be a perfect bill, but it'll be a start.
I'm just trying to get a sense of.
Well, we're listening. We are listening, but there's some things that we can't do. And people need to know that. And each party in the room is supporting its own perspective. And our goal is listen to what has come over from the House after the same conversation. And then how can we make sure that we have a balance in the bill that everyone can hopefully support. That's it. The seesaw. You know, that's it. Okay. Senator Benson. Oh, Senator Cummings is next. Sorry. That's
Just to refresh my memory, there is a section in this bill that allows discontinuance eviction for violence, danger.
Yeah. That's still it. Yeah.
I think that answers my question, because that was one of my concerns for the 30-day, if there is a real issue. Don't necessarily want the individual in there for another month if they are a potential danger to other residents.
Can you help us with this one?
Yeah, I'm trying to find the language.
Violence.
There's language. What?
Sorry, page 26. Thank you.
What page?
26.
Oh, yeah, okay, so this is. Um. So this is the language about the 14 days of continuing services. Unless, well, the decision before the Human Services Board is pending, unless the household voluntarily waives continued services. Or a household or a member of the household's continued receipt of services poses a risk of safety to others. There's other language, the one, there's misconduct. There's a violent situation, then one or more members of the household can be removed immediately.
Yeah.
I'm trying to remember where that was. That was under household responsibilities, maybe.
Page 21 talks about misconduct.
Thank you.
There's all health nurses will go into individual rooms.
Yes, I know.
Yeah. Improvements and expand numbers is asked for funding because of the amount of time you spend on the show. We have all nice.
Okay, so
Oh, here
here,
it is.
where are you?
I'm on page 20. A household may be terminated from the program for repeatedly refusing suitable placements. It's not what we're looking for. A member or members of an eligible household may be subject to immediate termination of services as necessary for the safety of others if the member or members are engaged in criminal activity or misconduct that is not related to a disability or victimization related to abuse, sexual assault, or stalking. And then we have a definition of misconduct.
So the question here is, and I think it goes along with what Senator Cummings is pointing out, with respect to an appeal. If someone is removed for any one or more of these things, do they have a right to appeal?
Yes. But
They don't have the 30 days.
that's it. I mean, they're immediately terminated, but they could still have an appeal process.
Okay.
But if they're, they're already terminated immediately, so they're not living at the residence anymore.
Behind you.
Brendan Atwood from Agency of Human Services. I just want to note our concern and confusion around section that Katie was just discussing, and it kind of includes this.
Which section?
Around misconduct. It says they can be removed for criminal activity or misconduct that is not related to a disability or victimization related to abuse, sexual assault, or stalking. It's the agency's position that anybody who's presenting a risk to others and their health and safety should not be exempt from removal. And we have some concerns about that language and the limitations around that and what that might lead in terms of appeals.
Yeah. Not a brain injury. We help our individual who's not confident to stand trial. But you kind of think about being in that whole place. It's a disability, but you can't be there. I've got a letter that I shared with you about same kind of individual who is breaking into cars every night. And right, could be breaking into other people's rooms. That's a hard one. But who do you protect?
And I would add, who makes that determination about whether that misconduct is related to a disability or not? I mean, these are exactly the kind of things that I think we will find ourselves in the appeals process for, and will be distractions from our ability to move forward with the transition.
Should we want to make changes?
You can come back with.
There needs to be a discussion about it. Brandon.
Brenda Siegel and Homelessness Vermont. We do have examples of times where somebody has had a singular violent act because they were put on the wrong medication with people with disability. And if they were exited, that would have spiraled, but instead we were able to support them and move them to a place where that better met their disability and get them the mental health support they needed. And we want to make sure that those folks are protected in this setting. We have also one example, which I shared with Brendan yesterday, of someone where we did not feel it was safe and we did not move them to a different placement. And so I think that there is very rare situations where we can't get them the support that they need, but if you have a whole section like this, whether or not the word misconduct related to a disability is in this bill, the ADA still protects people with disabilities and we will still be in fair hearings about that. And I would say more often if we don't have that protection in the bill.
Well, yeah, it's a no, but it seems to me that there ought to be some discussion and rulemaking process for this section. It sounds like a important discussion. Okay. I think that's something.
You'd like to put something in the rules?
Some kind of something rules there, yeah.
Okay. Well, what do you have in mind?
Would we put it into the rulemaking section?
Yeah.
Household determination. Household determination. Termination. So guidelines, appropriate guidelines for the termination of households.
Something like we had in recovery housing.
Yeah. Slightly different from that.
But it has a policy.
Yeah.
Yeah, when
that's what the rule.
Your disability through it's causing it's a danger to others. The behavior caused by your mental or physical disability is becoming a danger and would have to be dangerous. We have somebody in one of our housing places who tends to pace the floor all night and yell. And it's disturbing to the neighbor downstairs, but it's not life-threatening.
No.
If they took to shooting a gun to relieve stress, I don't know why he took the BB gun and shot the assisted living across the driveway. But that becomes a danger and it needs to have consequences. Because if there's no consequence, then the message is, well, you didn't do anything wrong.
Well, they are under the custody of the agency, so there would be some.
No, they aren't.
Oh, not that one, was it?
But I mean, not everyone.
It wasn't in the shelter.
But I mean, if they're in danger in the shelter, there might be a danger on the street too, so I don't.
We want to make sure that they receive the care that they need within the continuum. Yes. That's really the goal. And that any decisions will ensure that they receive the appropriate care, and I'd say through the continuum, and services. When
What if they don't?
when they may be terminated from the program. Then, yeah.
People
I have a question over here after Senator Cummings, and then you're in line. But
there are people who don't take their meds because they don't like the way the meds make them feel. But when they don't take their meds, they do some very dangerous things. They can be very dangerous to other people. If the shelters aren't safe places, then people won't come. Before sponsoring them, we have a responsibility to make sure that they're safe, that people aren't attacked, that they aren't being burned to death in the middle of the night or have shots come through the wall. The question is, how do you find that balance?
Exactly. Yeah.
Thank you, Chair. For the record, Alex Cramble, ACLU of Vermont. I just wanted to flag to the committee that in this section, on page 20C, page 20, it notes that a household will be terminated, but it doesn't give any parameters around termination length or how, a household could potentially be reintegrated into the continuum. So I just wanted to flag that if you're going to be contemplating this section, that could be another opportunity to kind of define more.
So for the rule, the language that you want to add is guidelines for immediate termination of services related to disability related misconduct. Does that sound correct? Okay. And did you want any other additions?
Could put something in there about reinstatement as well.
That would be a different bullet, I think. Let's see.
Okay.
Yeah, again, for the record, Chad Simmons, Housing and Homelessness Alliance of Vermont. So I would agree with the points that Alex made. And just to go a little further upstream, I think our members and our goal is to ensure that most people are eligible for services. And so simplifying at the highest level possible that most everyone is eligible for services is the goal. And in cases where I think it's really important that we're talking about safety, and I think these are some really good examples that you brought up and are also coming up in H772, the other bill that addresses loss of services in this particular case around safety related issues. To Alex's point, I think it would be helpful to include some language that instead of going straight to termination, looking at other services and supports for folks to maybe pause the emergency shelter situation that they're in, find respite care or other types
So
of
that's exactly the thinking I was had about within the continuum. And I think it's more appropriate for rules than having us might try and put it in here. We'd be putting the whole rule making process, all the rules in here. But I think that's well taken. Both your comments are taken.
If I could just add one note, one of the stated goals of the bill is to be efficient. I think we'll find more efficiency if that instead of terminating services, we get people the support immediately that they need rather than cycling through. So our members are telling us when people are terminated from services, they're just starting over again and they're creating more involvement across the state.
I'm looking at the agency for that one.
Yeah, I'll just note that, the language here uses the word may. And so I think that the discretion is already there. It's the agency's goal to make sure that these folks don't fall out of the continuum. And so I think that's consistent. Having additional language or this language, it limits our ability, to the points that I noted before. And so I think we agree with the approach to do this through rulemaking.
Okay, and if we have a rulemaking process around this, that will help make a determination about when it's not may, when it's shall.
That's right.
Okay. Yes.
Dana Hartog from our legal aid, just speaking about rulemaking, I think an opportunity also to clarify the appeals process for community providers could be done in rulemaking as well, so that this committee wouldn't have to necessarily put it in the bill itself, but just direct the agency to come up with some sort of rulemaking or appeals process for community providers, similar to other benefits that already exist.
I guess I wouldn't put that into rulemaking. That's a huge discussion around the table with legislate with policy. So I understand and appreciate what you're trying to do.
Yeah. But
to Senator Dulick's point, we have a little pumpkin coming up very soon. Anyway, there's a lot here that we could do, a lot more. Believe me, I get it. Understood.
I will respectfully disagree with you, which I never do, but I don't see why that can't be a book. It seems like a good place to really so the appeal process.
just to clarify, it wouldn't be a particularly substantial, complicated process. In Dale, at least, there's just a grievance process. So community providers or nursing homes, if someone disagrees with a decision, they grieve that to AHS. AHS reviews it and they either uphold or reverse. And then at that point, that person could then appeal AHS's determination on that grievance to make it the services board. It's just a way to avoid but just to hold everyone accountable. And that oversight.
So I'll let AHS comment.
Thank you, Brenda with Agency of Human Services. I'll just note that, you know, from the agency's perspective, and we provided a legislative report to this committee earlier in the year, we would propose some potentially significant reforms to the practices of the Human Services Board, and we welcome that conversation. We've started it up in House Human Services. We'd be happy to bring that conversation here to this committee. Even this session, we could kind of run through what we're thinking there. So all that to say is, we feel that this would be most appropriately addressed as part of that larger conversation around the Human Services Board, rather than try to shoehorn this into this.
Yeah, every door we open, we're gonna find others. Okay. And I do understand what you're saying, Senator, but there's a lot more there. Okay. Just bring it back, Kat. Okay. Okay, so we'll see something about that. Do we want to go to the rulemaking section briefly?
Sure.
And that's on page. I know this has been an issue about the wide open nature of the rulemaking. I think we just narrowed some pieces of it, which is good.
26 is the rulemaking. Okay, so at a minimum, rules are addressing requirements for community providers participating in the program, standards for highly structured, low barrier, and specialized shelters, specialized service shelters. I'm gonna make that change, service shelters.
So as we're going through this, I know that there are community providers in the room, and when we hear from community providers, we may ask the question again. So requirements, these are broad statements. Are there any modifying phrases or language that might be suggested here?
We have submitted language that's not about necessarily changing this language, but rather making sure that stakeholders can be participating appropriately in the rulemaking process, rather than being limited to the bare minimum in the Administrative Procedures Act, including making sure that process is accessible to people, and also making sure that community providers have input prior to the draft rule, asking for a review by your committee and the committee upstairs prior to promulgating the final rule. As you know, Chair Lyons, LCAR has very limited ability to accept or reject language in rulemaking, and we're very concerned about statements that have been made about intent of the agency and these rules applying to community providers potentially without substantial input from the providers.
Well taken. I think can there be language in here, Katie, that would have a more inclusive process?
I could add a sentence that says the department shall develop.
We have submitted suggested language.
Okay, can you email that to me? Shall develop. The department shall develop rules in collaboration with stakeholders. Initial proposed rules.
And it is about community providers, so they would be the ones engaged in that process.
Stakeholders. And I imagine do you want the committees of jurisdiction weighing in? I imagine their weighing in would just be limited to providing comments to consider that DCF could consider.
I mean, I had thought about that myself and how it could provide oversight.
Want to think about it?
Yeah.
Okay.
I mean, we can look at the language that CAPS submitted through Amy and perhaps include it.
Okay.
I know we have it.
Sounds good.
That was back tiny.
I know, and that was the question I was going to ask, is what is we have an effective date on the bill. What's the date for the rulemaking?
So you have emergency rules in effect July 1, 2026. And you go through a formal process after that. So there'll be continued rules. The issue is you have aspects of the program taking effect July 1, 2026. So they'd be operating without rules. As the bill is currently drafted if you push back emergency rulemaking.
Yeah, the whole timing thing is problematic because the whole program isn't fully in effect until 28th.
Well, the full program, but you don't have GA emergency housing to fill the gap.
Yeah.
So this is sort of the program piece that you have. So I guess the question for you is your comfort level and not having rules to govern the program when the program first starts.
Brandon?
Just thinking out loud here a little bit, I wonder, so the emergency rulemaking on 7.1 is probably not feasible for us, given that this bill is not even finished. So we share that concern, and we do think an October 1 date is feasible for that. And, I may regret this for not consulting with the team first. We'll go back and do that, but it may make sense to grant an extension of the existing rules in the interim period until the e-rules are up and running.
Rather than emergency rules or just?
Well, rather than have no rules in that
Well,
interim
maybe
period.
between July and October.
Correct.
Yeah, okay. Yeah, I think July 1 is pretty aggressive. Brenda, go ahead.
Friend Siegel and Homelessness Vermont. First of all, there are no current rules. They weren't promulgated, so that would be a difficult thing to do. So I just wanted to say that one piece we do have, they're not promulgated, so they've expired according to the law. And we're,
So I'm gonna turn to Ledge Council for that one, so just give your point, because we don't have a lot
okay.
of time.
So in terms of the rules themselves here, we do think that they're too broad, in terms of the requirements for community partners. That one piece, I would just want to make sure that people who aren't state funded are not taken away from that. And then, so that people who are providing services are able to provide those services, and that maybe instead you have to have these things, but not state funding. And number 3, 6, 9, and 11, I think are ones where that there doesn't need to necessarily be rulemaking authority. I'd have to look at them to remember why I have that in my notes. And number 5 was about appeals, and I would rather it was the current process.
Okay, so right now, the committee's gonna go through this.
Yeah.
So I'm gonna hold those comments until the committee's finished going through this. But what we have talked about so far is adding language that will include stakeholders in the development of the rules. We will have some date change, and Katie, remind us if the date were changed to October, what rules would be in place between July and October?
Well, nothing unless you specify something.
Okay.
But you could specify that you want the rules that were incorporated by reference in the fiscal year 26 budget to continue to be incorporated by reference for that period.
Okay. Okay, thank you.
Mm-hmm. Do you want me to?
But I do think there's no way emergency rules can be drafted by July 1. Like, sorry, you were gonna finish something else.
I was gonna go through the list. But
Okay, let's keep going through the list.
Okay, top of page 27, documentation requirements for household eligibility, including disability. Required elements for supportive services, including case management. The creation of a brief standardized initial assessment form that may be completed by hand, electronically, or by telephone. A process for issuing timely written approval or denial notifications to applicants. A process for issuing advanced notice to households when the household is being terminated from the program. Applicant and household appeal procedures. time limits for program participation, including procedures for extensions. Expectations for the office's oversight and quality monitoring, including performance measurements applicable to all community partners and grantees.
Well, guys, so this one, I think is really important for community partners to be engaged. And before we talk about an appeals process, I think we need to know how they're being measured and what the conditions are for acceptance in the program. This is.
And we have other subjects that deem necessary. And then the two that you just added, guidelines for immediate termination of services related to disability related misconduct. I'm gonna find a way not to say related twice. And then a process for reinstatement of services after termination.
All right, I know that there will be ongoing concerns about the rules. We're gonna have to trust the rulemaking process. Committee comments on this section. Okay. And any other sections that you'd like to look at? I'm not looking around the room exactly. Okay, so we are going to hear from a couple of community partners. And we'll try to get them in ASAP. We'll also are trying to schedule the chair of human services from upstairs ASAP, and that means tomorrow. Get those folks in, and then we'll, we're going to look at the funding pieces and well, that's the goal, hearing from Rep Wood or whomever she delegates on the funding piece, and we'll work through that with Nolan and with the agency. After we've heard from the community partners. Okay. Yeah.
Tomorrow.
What is it?
The ribbon cutting, the new shelter is tomorrow.
Oh, good.
So I don't know if they will get them.
We won't invite them, or maybe we will. Invite them at 9. No, they won't be there. We'll try and, well, and we also can have written testimony. I know we've already received some from COTS in Burlington and from others. So we can look at that written witness testimony and make sure it gets posted. Yeah, that we can help. And we have Zoom. Yeah, okay. Katie, I think what we're going to do, we're not gonna take a break, with apologies to everyone. We are gonna look at 817. I know there's one suggestion to improve that bill.
Okay, I'll
And
pull
then
that
we're
up.
gonna stop this a little bit early.
Okay, if you end up finding you have enough time, I sent a clean draft of 293. A little while ago, so
Yeah.
we have lots of,
Okay,
okay.
all right. We can look at that. We also have that posted for tomorrow, so maybe we can catch up on it today.
Oh, okay.
Yeah, no, that's good.
Okay. Here's 817. The last time we met, we wanted to make some changes, including having more collaboration with the Agency of Education. So, and the first, if you remember, subsections B and C are two different programmatic pieces. Subsection B is the mental health literacy training for adults. That the Department of Mental Health or designee shall select grantees in collaboration with AOE.
Wait. I was,
Can we make it? Oh, yes, I know. I don't know why. It's so tiny. How about that? More?
perfect.
Better? Okay. So again, this is the mental health literacy training for adults in the school. There's already language to the extent funds are available. The school may apply to DMH or designee for a grant to provide this training. The sentence that's being added is that DMH shall, or a designee shall select grantees in collaboration with AOE. So that was my way of, having that collaborative piece with AOE. Then in subdivision 2, the suggestion from the editors to have specific occur twice. So that the section shall not be construed to require the adoption of a specific curriculum or specific instructional content. So that's why that is there. Peer-to-peer mental health support. In subdivision 2, DMH, in collaboration with AOE, shall provide guidance to any school, after-school programming, or youth mentoring agency seeking to establish or maintain peer-to-peer mental health program. And then in the guidance, so for mental health literacy and the peer-to-peer support programs, DMH, in collaboration with AOE, shall develop age-appropriate guidance. Subsection E is the reporting, and now the report is coming from DMH, but it's in collaboration with AOE. And then you have this new section about funding. As part of its fiscal year 28 presentation, DMH, in collaboration with AOE, shall explore potential funding sources for programming established in the section above, including whether any existing special funds are appropriate sources of funding, and provide recommendations to the policy committees. And then the date was bumped out from 26 to 27.
Okay, so I did have a request to consider camps or out of school support.
After school is,
Okay, after school, which is a specific program.
Right.
well,
Out of school is slightly different.
I think after school encompasses
The whole
school
world.
vacations too.
Okay,
I'm happy to be corrected on that, but I thought
okay.
was the time literally after school vacations, and I thought summer vacation, but if I'm wrong.
Oh, yeah, it
that could be
does.
correct.
No, it definitely does that. Okay.
In Charter, not after school. They generally say after school and summer. As a
Together.
phrase.
Okay.
Also, Nicole Miller had asked for consistency to name after school also in the funding section. I don't know if you saw that, you know, from her. It's named above, but not below.
Okay, let's look at the funding section and section 2. So including any existing special funds, and the after school is a special fund. We also know that there's a substance use misuse prevention fund, special fund, that could be used here, though it's substance misuse is not directly related to mental health. I suppose have called it right. Yes. No.
For the record, no language went for stuff. It's just a small, right, I'd say it's part of the fiscal year 2028 budget presentations. Or documentation, you know, or just put it as budget.
Project presentation.
Oh, good idea.
And then, my other concern is just, again, you're creating a program without the funding. So even though you're saying the funding will go, the program goes into effect, but in the meantime, find the funding. What if you don't find the funding? You know, or the government doesn't put the government doesn't put forth any funding for it in budget. So that's my.
Senator Julius.
I don't know if everyone saw the testimony from the AOE.
Yes.
But they're suggesting that there's a lot of work already going on in various places and that a study would be a really good idea to find out what's happening where and coordinate it all, which I think is probably a good idea.
That's an excellent idea. Thank you for that. So can we add that in to we have that little.
Add it or in lieu of?
It seems like it's almost in lieu of.
It's a.
Okay, with any recommendations for further funding needs?
And more fires.
Yeah, let's do in lieu of. Good idea.
Yeah.
And in lieu of the whole bill?
Huh?
I think that's what they're suggesting. You just.
No, I think the adult section.
No, it's looking at what's currently happening and to give a report back on all of those programs that are currently going on, how they might be, coordinated, how they might be improved or extended, and then any recommendations for additional funding
So
sources.
you want it, so in other words, this section 2 would say something like funding, coordination. And then as part of its budget presentation, it's gonna weigh on potential funding sources. And then a review of how to coordinate the existing work around mental health in schools with this section.
Do you want me to read from this?
Yes, please.
This is rather than establish new statutory programs that may operate in parallel to existing efforts, we recommend prioritizing the development of a unified statewide framework that aligns education and mental health systems, clarifies expectations from schools, and ensures equitable access to high quality supports. And so we urge the committee to consider revising the bill to focus on statewide guidance alignment and capacity building led by the AOE, Department of Mental Health, and then strengthening provisions related to peer-to-peer programming. But all of that would require a study and a report.
I've been nervous about peer-to-peer.
I think this could help with that, maybe.
Yeah, it could help with the criteria guidelines.
Yeah.
Nolan, you wanted to comment?
Yeah.
No,
You're good.
yes.
So Senator Ulick's suggestion is to take the AOE's recommendations. Would it replace the entire bill?
And in lieu of new provisions established by H 817, we urge the committee to consider the alternative of directing DMH in consultation with AOE, BDH, and DCF to complete a comprehensive report of existing programs and resources which support mental health with recommendations for potential policy improvements due December 31st, 2026.
So what I would suggest is prior to the implementation of the program above, so allowing for the language that's in the bill to go forward, to have a report on those things that are currently happening, rather than gut the whole bill. Right. But just to have the information that's needed to make a good decision, and that will get also to Senator Cummings' concern about peer-to-peer.
Now, I'm just wondering if we got does that leave the Department of Mental Health? Because they were supposed to be doing work on the adult section, right? Do we have them developing two sets? We asking them to develop programs. At the same time, we're asking them to study what program should be developed. See,
But there are things already going on that will inform any new program. So that's why I say prior to implementing any of the, in section 1, I think it is, then. So I've got Nolan and then Claire.
So again, my concern is you're creating and setting up a program.
Yeah.
Down the road without an appropriation. I think what I hear the AOA saying is, why don't you do an inventory and a program implementation plan? And then they come back with a proposal on how they might do it instead of telling them to do it regardless of the study.
Well, that's exactly what I'm saying, that what's in the bill currently they can evaluate how that fits in with all the work that's currently going on.
But I heard you still say, still have the program starting in 2027. So that's my
No,
concern.
I didn't say that.
Okay.
That prior to any implementation, take the
Or
data,
you can just find
prior to any,
the program.
yeah, no, yeah, you're right. Claire,
Yeah, Claire Neal, Senior Policy Advisor for the Department of Mental Health. We would support an inventory before creating a new program. I think there's a lot of existing work in this space that we would want to make sure people are aware of and are able to access before we start anything new. We would be comfortable with providing written guidelines for peer-to-peer programs, since we know that those are sometimes already happening. We're happy to kind of lay out some best practices for that. I do think one thing that would be included in our guidelines would be mental health literacy training for adults who are running these programs. So it's a little bit the timeline. We would want to, that is the best practice. So we would want to make sure that the peer-to-peer programs have a trained adult.
okay,
I think I could go on the board too.
yeah, very much. So it's not that we're eliminating the work that the House has done. Rather, we're seeing it as maybe something that already is happening. And how do we know that? So looking for information.
So can we summarize what we are right now?
Trying to write all of this
Well,
down and.
I'm also managing what's happening in another committee, so I'm doing all things at once. So you would like to keep section 1 as is of the bill?
Without a date of implementation, just as a program.
What, meaning that that section of the bill doesn't take effect? And what does it mean not to have a date of implementation?
Well, it means that prior to implementing any program in section 1, that the DMH and AOE will evaluate current programs.
It seems like what you'd
What do
want to
you-
do is do tiered effective, like tiered dates. So you'd want to have this prior inventory taking effect now and do, let's say, January 1, 2027, and then you could keep your effective date for section 1.
Section 1 effective date is July, so yeah, we could keep that.
Okay, so you want an inventory to know what's happening now.
There's no money.
No, that's right.
So we're setting up a program that will go into effect with no budget.
However, the recommendations from AOE and DMH might include.
Maybe it is the intent of the legislature to set up X program. By date certain, AOH and mental health, DMH will study available present programs, available resources, and bring that recommendation to us next year.
There it is.
Perfect.
That's it.
So then we're striking section 1.
Did we strike section 1?
I think so.
I don't, to set up a program.
Yeah, I know.
And then they come back in next year and.
Yeah. But maybe we could reference the report out of which section 1 came. That report was January or December 25. Okay, if that's a problem, we won't do it. No.
So the report could have recommendations on how to stand up a program, because you're putting it out for 2 years anyway.
Right.
And the legislature can say, great, here's a recommendation on how to stand it up. We are going to put in our budget and standing it up.
Right.
Okay.
Then what you're doing is they're doing all the back work for you to do, because if it's out 2 years regardless, they're providing you with the framework on how to do it. And all you can say, yes, you want to do it, and then it becomes part of your
That makes
budget.
sense. You've all convinced me, to strike section 1.
that what you were saying?
Yeah.
The house will love it.
I was saying you're right. I don't know, it's like something.
We don't call it unfunded mandate.
That's all I was trying to flag. Or you could just fund it.
You have it now?
The budget that's already. passed.
Yeah.
Budget's gone.
But you're not gonna fund it until.
It's not, it's not an easy
What?
bill though, so.
So,
She was pointing at me.
Unless you have any.
Thank you goes to rental spring.
Yeah, why not? So let's I think we are.
Okay, wait, Katie has something to say that's important.
I don't know if it's important, but I want to make sure it's
Much more important.
Okay, so, we're going to strike section 1 of the bill. We're gonna have a legislative intent section that acknowledges the 2 programmatic pieces, and it's the intent to have those up and running, funded by July 1 of 28. In the meantime, we're going to have this report back during the budget about funding it. And there's going to be an inventory of what's currently happening and how to coordinate the proposal with what's currently happening. Is that right? Okay.
That's beautiful.
Okay.
No.
Okay.
I was on the conference.
Well, I'll give you the, now when you go to conference, we can fine tune that line.
Yes.
Okay.
All right.
And I wanted to remind you, do you have anything to discuss related to 816 before you adjourn today or no?
That's John.
No, I presented, it's going to get amended.
We have an amendment, I think. Did we do the amendment?
We talked about it yesterday morning.
Yeah, oh, here it is.
Talked about it. Okay.
Senator Hashim and I have an amendment, and do you wanna, do you have that? We got 5 minutes.
It was up to you. I just didn't want to fall off your radar if that
No,
was your
it's not, it's
goal
not
for
off the
today.
radar at all. It's
Okay.
that he's very concerned about, certain sections of the bill, including, right of action.
We put a private line, but have you shoot at that? Okay. Okay. Do you want me to talk about that or?
Yeah, do you
Okay.
have this?
I don't have it pulled up, but I can do it from memory, I think.
Okay.
So in section 3 of the bill, there are 2 places where individuals were referenced. Oh, I did talk about it and you
Yeah,
wanted
we
the
did.
language.
Yes.
And I still don't have the language. Let me pull it up. Okay.
Do you want this?
Sure. Well, no, you want to see it. Okay.
We all want to see it.
Okay, let me pull it up.
And don't take that away from me, it's my only copy, but.
Oh my God.
Katie and I met with Senator Hashim in the coat room, during the session yesterday.
Okay.
Fourth session.
Here's the amendment itself. So first, subsection B would be rewritten. To say mental health services shall be provided in Vermont through artificial intelligence only if a mental health professional reviews and approves the artificial intelligence generated output prior to the information being transmitted to a patient, client, or artificial intelligence user. So this would have the effect of, if the mental health professional themselves is using AI, then they would, have to review the output prior to, transmitting any of that to a patient, which we had talked about. It probably also has the effect of if there is a corporation, an entity that is hosting a chatbot in Vermont that intends to answer questions related to mental health services, that would have to be reviewed by a mental health professional, which potentially means that corporation or entity would have to hire a Vermont mental health professional to screen those responses prior than going to an AI user.
Where's the private right of action?
Huh?
Where's the private right of action? Did we have one in there? I didn't check.
No, I think we got through that one, okay. There's no other.
Is it under consumer protection?
Yeah.
Because consumer protection has a private right of action.
Yeah, it's enforced by the AG's office.
Yeah.
Yeah.
So you're just saying a human being has to see what's being.
Yeah, a mental health professional, not any human being.
A mental health professional human being.
Yeah.
At least a master's.
Okay.
Well,
No.
as defined in your bill, a mental health professional has to
Right.
look at it. Yeah.
Okay.
Okay, so
I know,
Senator
right?
Hashim is gonna present this on the floor.
Okay.
Speaks the therapy dog of mental health professionals.
Oh, there. All right,
Okay.
I think
we're gonna wrap. We are wrapped. Are we okay? Let me just ask first.
Gail, sorry, can I ask Gail? She's okay?
Sure.
I'm just looking at it for the first time,
Okay.
so.
Okay.
They'll have to let us know, in this third reading and everything else.
Actually, yesterday.
So,
Will it be on the floor today
Yeah.
or tomorrow?
Yeah, today, second
Yeah,
reading today.
this
could be on today.
11.
All right, so, and this is Senator Hashim's. If you would like, we can meet in the corner when we're up on the floor. Or if the committee is okay with this, we can move ahead with it.
I mean, I think I'm okay with it.
I think I'm okay with it too.
I like to hear.
Yeah, if there's a hue and cry from our friends,
Yeah.
we'll go with that.
Okay.
Otherwise, I will just say straw vote. We're okay with it. Okay. So now.